Hi, I'm Jolijn Sandkoets. I'll start with the overview of my presentation. I will first share my personal experiences, and then I'll talk about universal human rights and the implications of the UN CRPD. And I will explain how this will mean a new era in the field of mental health care. Well, my personal experiences. They started when I was age 16. I felt weird and insecure and confused about life, and I thought I didn't fit in, and that made me very depressed, and then I did a suicide attempt. Then I was put into a psychiatric hospital against my will because I was very scared of everything, so I didn't want to, but they still did it. And then I was at this ward, and there were all people that I didn't know, and I found it very scary. So not soon after, I did another suicide attempt. And this was in the evening, and then after returning from the hospital, the nurses said, like, we don't have time to watch you 24/7, so we'll put you in solitary confinement for your own safety, because I was so-called danger to myself. So I was put in solitary confinement, my clothes were taken off, and of course I felt more miserable. I felt like the world didn't want me, which confirmed my feeling that I didn't fit in. So the moment they opened the door, I did another suicide attempt and self-harm. So they locked me into the solitary confinement again, and they gave me a seclusion program because they said it was unsafe to let me out. And I just it went worse and worse. So I started banging my head against the wall, and then I was restrained on the bed. And then they also did forced body cavity search, which means they took these rubber gloves, they pushed me to the floor, and they invaded all my holes in my body when I was 16. And they did it to check for dangerous materials, but for me it felt like rape. So that all didn't help, it only got worse and worse. So I was stuck in this seclusion program in the child ward, and then they moved me to the adult ward at age 17, where they said they would have had more options for treatment, but it was only more coercion. So this went on another year, and I wasn't listened to. When I said, I cannot live like this, you're driving me into suicide, they were just not listening. And even when I had medical injuries, like a broken Achilles tendon, they didn't believe me. They said I was only seeking attention, I couldn't walk, I was in pain, but it lasted a couple of days before I was allowed to go to a doctor. And this doctor said, and he was shocked, he said, like, if you had appendix infection and they hadn't believed you, you would have been dead by now. So he alarmed the system, and this ward was closed. And I was transferred to another ward in another city, and it was really different. It was a so-called psychiatric intensive care unit, and the first thing they did was not put me in solitary confinement. And even after self-harming, they would say, like, oh, you probably already lost the anger that you had been building up, so why exclude you after an incident? It doesn't add up to anything, because generally those things don't happen like in a minute after each other. So they didn't focus on risks. They saw me being stuck in the system, and they treated me with more respect, and it made a huge difference in my life. Because at the other ward, when the nurses were treating me so bad, I felt like they were my enemies, and I didn't want to become like them. I didn't want to listen to them, I didn't want to talk to them, because they didn't understand me. And in fact, because I was solitary confined, all I had was myself. So I came out to myself, and I got only stronger in my resistance to the nurses, while the other one, there was no such need, because they were more fair, more equal, and I could see that they were human beings with trying to do something, and that made a real difference in my life. So I survived because of respect, and not because of coercion. I barely survived the coercion. So for me it's very clear, coercion is the opposite of care. Care is supposed to make you feel better, to support you in gaining your life together, and it's coercion, it's totally disabling care, because you're not going to take an advice of a person that you feel like is your enemy. So since then, this is my opinion, and of course I felt I was hurt by the system, and I come from the Netherlands. Many people think it's a paradise. Well, for me it wasn't. And I had always believed that there was justice. So I tried to make complaints about the treatment. And when I was at 16 years old, of course I had no knowledge of the entire legal system, but I knew that it was wrong to lock me up, and I should have been treated better. And so I tried to make complaints, but I'm sure many of you know that as a patient, it's you're often not listened to. They also said, like, but there was danger. So when there's danger, they can do anything, regardless when they even add up to the danger. So all my complaints were rejected. I never made it into court. I'm still trying. It's now 22 years ago. I still haven't stopped. I have sent my complaints even to the UN Special Rapporteur on torture, who communicated to the Netherlands, but still the Netherlands is not willing to investigate my complaints. So, in my opinion, I don't have rights. And that hurts me. So I decided to be an activist, because I heard in my surroundings that much more people suffer from these situations, that they are not listened to, and that they are in fact hurt by what should help them. So in 2002, I received a text message from one of my friends, and he said that another boy in the institution where I was in, the child institution, he had been put in solitary confinement because he took the dessert from the table to his sleeping room, and was not allowed. So they punished him by putting him into solitary confinement. And I got this text message because my friends knew that I was already trying to make something about that. So I got very angry, and I thought, I have to do something about it. So I took the train back to the institution, and I thought, what can I do? And of course, I cannot break the institution, or the windows, they are so strong, and you feel quite powerless. But I was thinking about public prosecution. It was just a word that was buzzing around in my head. And then I thought, yes, I'm going to make it public. So I went to the supermarket, and I bought a lot of papers and a big fat marker, and I made some slogans. So like, if a parent cannot put you in a shed, why are there solitary confinement in childcare? All these kind of slogans, and I spread them around in the village near the institution. And the next day it was in the newspaper as an anonymous protest against seclusion. So I thought, hey, this works. So since 2002 we had an informal protest group. We did some protest marches and some more poster actions. And Well, after I was still studying, I studied sustainable engineering, and when I graduated, I won a prize with it, and that gave me the money to establish an officially registered NGO in the Netherlands, which is called Mind Rights. And in 2007, I went to Africa to learn more about mental health, and I got in contact with some international user movements, such as the World Network of Users and Survivors of Psychiatry, who had their General Assembly in Uganda in 2009. And I went there and I was elected into the board. And in 2013 I became one of the 2 co-chairs of the World Network. And in 2014 I also became a board member of the European Network. But at this General Assembly in 2009 of the World Network, I learned that there is a new UN convention. It's about universal human rights. It's the Convention on the Rights of Persons with Disabilities. It had been adopted by the UN in 2006, and after a number of signatures, it entered into force in 2008. And by now, most countries of Europe have ratified, except for Ireland, but they are working towards it. Also, the European Union as a whole has ratified the CRPD, that's the abbreviation for Convention on the Rights of Persons with Disabilities. And this is unique, because the European Union has never ratified any treaty. This is the first treaty they ratified, and they want to take it very serious, because the EU wants to be a role model for the countries and also beyond. So this is very important for all European countries. Last year there was even, EU was reviewed by the CRPD committee, which is a committee of experts on the Convention on the Rights of Persons with Disabilities. And they made recommendations what should be changed in Europe. And this is very interesting. I'll come back to that later. This UN convention is part of the big universal human rights framework. There's a lot of conventions, like the rights of the child and the rights against the discrimination of women, and there's some more. And in fact, they all contain the same human rights: the right to education, the right to good quality of healthcare. But for some groups, they were forgotten by the way the world is. So they made these special conventions for vulnerable groups. And now there is this UN Convention on the Rights of Persons with Disabilities. And it's addressing a lot of things that needs to be challenged. So a few very important articles are Article 12, which is about legal capacity, which means you have the right to have your own voice, and you have the right to be recognized as a person before the law, an equal person, equal to any others. So that I'll come back to that later as well. Then Article 14, liberty, it's about freedom. Article 15 is freedom from torture and ill treatment. In fact, it's also very relevant since there have been quite a number of documents written by the UN which address forced treatments as being torture, because it's backed by the system and the laws. So it's actually a governmental oppressive system meant to change people. So there's some criteria that makes it torture. Then there's in fact all the articles of the CRPD are relevant also for mental health care, but these are the most important. Article 17, physical and mental integrity, it speaks for itself. Article 19 is said to be the second heart of the convention. Article 12 is the first heart, that you are recognized as a human being, as a person, equal to others. And Article 19 says you have the right to live in the community, to be part of the community, and not to be excluded. And this is very important. And then Article 25 is the right to free and informed consent. It's actually the right to help, but free and informed consent to any treatment is the most key aspect for the mental health care system, because that's a challenge that still needs to be changed. So I'll walk you through some of these articles, because they are really, I hope they will inspire you. So Article 12, especially 12.2, it says that all persons with disabilities should enjoy legal capacity on an equal basis with others in all aspects of life. So, and legal capacity, it's interpreted in it's a twofold so on the one hand you have rights, so you have the right to be not tortured. That's because you are a human being, you have this right to be free from torture. But you also have the right to act. Because all of you, all adults, they have the right to act, to be independent. You can decide for yourself how you want to live your life. If you refuse a cancer treatment, that's your right. But somehow it's not allowed to refuse psychiatric treatment. So that's weird, and that's in fact discriminatory. But of course, it's not a very simple issue. Then Article 12.3 addresses that instead of taking over the control and the choices, what is needed is to offer support so that the person can make their own choices in an informed way, knowing what are the consequences, fully understanding the decision, and being allowed to be who you are. Your choices make your identity. If you're not allowed to make choices, you cannot have an identity. And actually you cannot even grow and develop, because people learn by trial and error. And if you're not allowed to take risks, to fail every now and then, and to learn from that, then your life is put on hold. So this is why they say there must be support to exercise legal capacity. And this is why this is the new term called supported decision making. And if you Google it, you'll find a lot of new practices and thoughts about it. And I hope this can inspire you to think about it and how to change this into your practice. Then in Article 12.4, it's again stressed that the safeguards of the system should ensure that all the measures related to the exercise of legal capacity should respect the rights, the will, and preferences of the person. So this is again confirming that we are entitled to have our own voice and to make our own choices and to be who we want to be and to live life according to our own ways that we want to live. And there's some more state obligations in this article. And then the next article is Article 14, liberty and security of the person. Like I said, the EU review by the CRPD committee took place last year, where this committee of experts reviewed the report that the European Union made about the state of affairs in Europe. And the committee made some recommendations on what could change. And it was about all kinds of disabilities, so blind people, people, sign language users, but there was also a significant document attached to the concluding observations, which are the recommendations. And this 15-page document is called the Guidelines from Article 14. And in this document, which you can find on the internet as well, on the website of the CRPD committee, you will see a lot of arguments and reasoning and explanation why forced institutionalization is a violation of human rights under this treaty. And since all European countries have signed this treaty, it's going to be a challenge to actually implement this and to change the state of where we are now. Because now, in every country, actually almost in every country of the world, we have a system that enables forced psychiatric treatments, and it's against human rights. So it's a worldwide challenge, and the real alternatives, they have not been developed so far. I bet you all know that psychiatry, in fact, it started after the Great Confinement, when everybody was locked up. And in the past, all admissions in psychiatry were forced admissions. There was no voluntary care. And it's only been started during the past ages. And now we have to take it further. We have to really make a difference and stop coercion and stop dragging people to all places where they didn't choose to be, but really see how can we help a person. And in Article 14, it's very clear that the existence of a disability shall in no case justify the deprivation of liberty. And in the guidelines, it's explained that also the existence of a disability plus another factor, it's still based on disability, so the deprivation of liberty is not legal. So if you say mental illness plus danger, it's still illegal because you link to the disability. In Article 14.2, it says that if persons with disabilities are deprived of their liberty, and this means that, of course, when you commit a crime, you can be convicted to a sentence in prison. But the prison sentence cannot be more heavy than for another. So you can imagine if for a blind person, if they are put in prison, they cannot find a way. It's much more heavy for them to be put in this prison than for a person who is fully able. So also for persons with psychosocial disabilities, there is this additional burden often. So that's why they say there should be reasonable accommodation. You have to take into account the needs of the person so that the criminal conviction is not putting more pain to the person than to other persons. So this is another challenge. We know that forensic psychiatry is much heavier than regular prison in almost all countries I know. So, well, this is unequal. So this is also needing to change. Then Article 15, freedom from torture and other cruel, degrading treatment. Well, treatment, we know that. I found my treatment very inhuman, cruel, and degrading. And maybe it was also a bit of punishment, I don't know. But it's totally relevant. And also the addition, medical and scientific experimentation without consent, it's torture. But we know, even in the Netherlands, last year there was a case of drug testing in a clinical setting where the patients were not informed. It still happens. And it's classified as torture, and torture is absolutely prohibited. There is no excuse to say like, oh, but in this case we torture this person. So also economic lack of resources cannot be a reason to torture people. You cannot hurt people because you have no money. It's the same as abuse. There's no valid reason for abuse ever. So all this last resort reasoning saying, yeah, but there is no other option because we never invested in real good voluntary preventive healthcare. So well, yeah, this is the situation. So then we use force. It's torture. and the UN Special Rapporteur on Torture. In 2013, he wrote a report about torture in healthcare settings, and he also addresses the use of any non-consensual intervention that can amount to torture, depending on the threshold of powerlessness, suffering, because it has to meet some kind of severity before you can classify it as torture. But in general, in most psychiatric coercive situations, these criteria are met, and it could be classified as torture. So this is, Europe banned the death penalty, and I think it's now our task to ban torture. Then Article 17 is relatively straightforward. Every person with disabilities, every person, so also me and all other users, have the right to respect for their physical and mental integrity. So I have the right to decide what happens inside my body. And other people cannot intervene that. It's my right to be who I am. So forced medication, no longer an option. And if you look at the concluding observations on the EU, you will find a strong section on Article 17 saying that forcefully correcting the disability of a person is invasive and it's a violation of integrity. So this is again confirming that forced treatments are no longer legal. Like I said, Article 19 is the second heart of the convention, and it's about being included in the community. We are people too. We don't need to be put away. We want to have the same joy in life as others.